Hey everyone, this is Mad Amigos. So we wanted to go to the street, ask people what do they know about diabetes and how do they deal with, if they have anyone in the family who have this disease or not. Let's see what they will say.
Well, I know it's disease. I know that people who are suffering with diabetes, they had some problems with insulin hormone, and they're supposed to take injections, like insulin injections.
Diabetes is a very serious health crisis. Yeah, and it apparently it can appear in every age, but generally it happens for the old people. That is because of the insulin, I guess.
I think that I don't know enough about diabetes, but everything that I know that it's worldwide disease.
Сахарный диабет. Да мало чего знаю о сахарном диабете на самом деле. Но знаю, что при сахарном диабете вроде нельзя кушать сладкого. Там у них какие-то препараты назначаются вроде.
Практически ничего. Люди, у которых какие-то проблемы с сахаром в организме, это мой максимум.
О диабете страшная болезнь, которая, если есть, люди живут с ней, тяжело жить. Какие-то привязки, приходится постоянно проверять там сахар, постоянно, чтобы был инсулин вроде бы колют они. Чтобы все это было под рукой, без него они практически могут погибнуть.
Я знаю, что диабет – это не очень хорошая болезнь. И то, что в последние годы в России большой рост людей, которые болеют диабетом. И в стадии я знаю, что от ожирения люди переходят к диабету, к сожалению.
Сахарный диабет? Сахарным диабетом болеют люди с пониженным количеством сахара в крови вроде бы. Вот, все, что я знаю.
Значит, выделяют два типа сахарных диабета. Это сахарный диабет первого типа, сахарный диабет второго типа.
То, что существует такая болезнь, у кого-то она с детства проявляется с рождения, у кого-то в процессе жизни приобретенный бывает диабет, бывает наследственный, да. Бывает у людей стадия преддиабета. И многие находятся в ней, не замечают это, не сдают анализы, не в курсе этого.
У меня есть знакомый диабетик, но в принципе он с этим с детства уже свыкся и все нормально, мы поддерживаем связь. Иногда, конечно, бывают какие-то проблемы в плане принятия лекарства, поэтому я помогаю ему с этим.
Диабет – это аутоиммунное заболевание, предшествующее отказу работы поджелудочной железы. Бывает два типа, первый, второй. Первый тип – это инсулинозависимый, второй – это не инсулинозависимые. Все, что знаю.
Я знаю то, что человек носит какие-то аппараты, то есть он может упасть в обморок в какой-то момент, у него инсулин падает. И слышал то, что нужно ему либо какую-то шоколадку дать, и какой-то специальный...
Диабет – это хроническое заболевание, которое вызвано тем, что в организме вроде как не хватает инсулина. Это заболевание смертельное, но оно вроде как лечится.
Я знаю, что и много что нельзя делать, во-первых. То есть, грубо говоря, даже курение, в принципе, влияет больше, чем на обычного человека. На здоровье, получается.
Знаю то, что сахарный диабет – это достаточно опасная болезнь. Если не следить, то можно пострадать сильно от этого. Сильно не увлекалась, не могу сказать.
Диабет – это заболевание, связанное с нарушением обмена веществ. Бывает врожденный, приобретенный.
Диабет – болезнь, вызванная большим количеством сахара, насколько я знаю.
Energy is the ability and strength to do an active physical things, and the feeling that you are full of physical power and life. Everything has its own way to produce energy, but when we talk about the human body, insulin is the main power source. Insulin is a hormone made by the pancreas that allows your body to use sugar or glucose from carbohydrates in the food that you eat for energy, or to store glucose for future use. In case of insufficient insulin or the pancreas is not producing insulin at all, this may cause a disease called diabetes. The first known mention of diabetes symptoms was in 1552 BC, when Hassi Ra, an Egyptian physician, documented frequent urination as a symptom of a mysterious disease. Also around this time, ancient healers noted that ants seemed to be attracted to the urine of the people who had this disease. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. This occurs when the pancreas does not make enough or any insulin, or when your body cannot use insulin correctly to break down the sugar in your body. The main symptoms of diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, and blurred vision. Also, frequent infections such as gums or skin infections and vaginal infections. The main reasons that the pancreas does not produce insulin is that the body's immune system attacking the insulin-producing beta cells in the pancreas. The beta cells become damaged, and over time the pancreas stops producing enough insulin to meet the body needs. Diabetes is characterized by high blood sugar. This results from insufficient insulin production or function, which can be one effect of problems with the pancreas. People with diabetes experience high or low blood sugar levels at different times, depending on what they eat, how much they exercise, and whether they take insulin or diabetes medications. Type 1 and type 2 diabetes both involve the pancreas. Type 1 diabetes happens when the pancreas does not make enough or any insulin. Without insulin, the cells cannot get enough energy from food. People with type 1 diabetes can rebalance their blood glucose levels by receiving insulin injections or wearing an insulin pump every day. It often developed during childhood or teenage years. There is no clear cause of type 1 diabetes. Some evidence suggests that it results from genetic or environmental factors. An estimated 1.25 million people in the United States are living with type 1 diabetes. Type 2 diabetes. This type occurs when the body builds up a resistance to insulin. While the pancreas may still produce the hormone, the body cells cannot use it efficiently. As a result, the pancreas produces more insulin to meet the body needs, and it often unable to keep with the increased demand. With an insufficient amount of insulin in the body, diabetes develops. Over the time, the beta cells become damaged and may stop producing insulin altogether. As with type 1 diabetes, type 2 can cause high blood sugar levels and prevent the cells from getting enough energy. Type 2 diabetes may result from genetic and family history. Lifestyle factors such as obesity, lack of exercise, and poor diet also plays a role. Treatment often involves increasing levels of exercise, improving the diet, and taking some prescription medications. A doctor may be able to detect type 2 diabetes early in a stage called prediabetes. A person with prediabetes may be able to prevent or delay the onset of the condition by making changes in their diet and exercise routine. Almost half of the world's population have diabetes. If you manage it well and follow the prescriptions that the doctor prescribed, you can have a normal life and live like any other healthy person. If you're diabetic, you should follow a specific diet prescribed by your physician. As with any healthy eating program, a diabetic diet is more about your overall dietary pattern. Rather than obsessing over specific foods, aim to eat more natural, unprocessed food and less packaged and convenience foods. You should eat more healthy fats from nuts, olive oil, fish oils, flax seeds, or avocados. Fruits and vegetables ideally fresh. The more colorful, the better. Whole fruit fiber rather than juice. High fiber cereals and breads made from whole grains. fish and shellfish organic, chicken or a turkey. High quality proteins such as eggs, beans, low-fat dairy and unsweetened yogurt. You should stay far from trans fats and partially hydrogenated or deep-fried foods. Packaged and fast foods, especially those high in sugar, packed goods, sweets, chips and desserts. White bread, sugary cereals, refined pastes or rice, processed meat and red meat, low-fat products that have replaced fat with added sugar such as free yogurt. If you're diabetic, you should stay active. Talk with your healthcare team before you start any new physical activity routine. Especially if you have other health problems, your healthcare team will tell you a target range for your blood glucose level and suggest how you can be active safely. If you stay fit and active through your life, you will be able to better control your diabetes and keep your blood glucose level in the correct range. Controlling your blood glucose level is essential to prevent long-term complications such as nerve pain and kidney disease. Don't forget to stay hydrated, as doing physical activity may lower your blood glucose. Finally, hope I cover all the information you may need to know what is diabetes. Please stay safe and take care of yourself. Peace.